good.
I think it was
Hey,
good.
high five. Hi guys, we're here today at Mission Private Hospital. Hi guys and welcome. I'm Dr Bronwyn Hamilton, obstetrician and gynecologist. We are here today at the clinic, Melbourne Eastern Women's Specialist, and I'm lucky enough to be joined by Dr Swaroopini Thangarajah, who's a GP based in Melbourne, Australia. And yeah, very exciting to have her here today. So how are you going today?
Yeah, feeling fine.
Yeah.
Thanks for having me.
Pleasure. Thanks for coming. That's awesome. And many of you may or may not know, but Dr Swaroopini is currently expecting her first child. Very exciting.
Yes, it is. Very nerve-wracking too. It's very different being on the other end as a patient.
Yeah. How's everything going for you?
Yeah, so far so good.
Yeah?
It's been nice. Yeah.
That's awesome. Yeah. Beautiful. So Dr Swaroopini is an experienced GP. She's based at Mentone Medical Clinic in Melbourne, Australia. She has a keen interest in women's and children's health. She has many qualifications in those things. So yeah, I thought I'd just ask you a little bit about what keeps you busy during the week? What kind of things do you get up to?
Yeah, a couple of different things. As you know, I help you out with some surgeries as well, which is really exciting.
Yeah.
So we get to help out with the cesarean sections and
Meeting
some women's health.
babies.
Yes, it's very exciting. So blessed to be able to do that.
Yeah.
And then I get to work in my GP practice as well. So do some chronic disease management for patients as well and their families. And then I get to work in some hospital pregnancy clinics and help out with some teaching of medical students. So it keeps me busy.
Never get bored with that variety.
Yeah.
Fantastic. So I thought today would be a great opportunity for us to cover home pregnancy tests, when to do them, and what are the next steps, and also cover a few other early pregnancy topics. So I thought we would just start chatting about home pregnancy tests. When is the best time to do that for someone that's expecting to becoming pregnant?
Yeah, so I think the best time is as soon as you think you've missed your period, you can do a urine pregnancy test that you can pick up from the pharmacy or the supermarkets.
Yeah.
And once you've got one that's positive, I'd say don't do it again. I know many women do 3, 4, 5 times because they don't trust the first one. And then, just do it once and then book an appointment to see a GP. Leave that to us to share that worry with you and then tell you if you're pregnant or not. So that's probably the best way of doing it. So I'd say as soon as you know that you might be pregnant, go and see the GP and we can organise some next checkups for you.
Fantastic. Yeah, beautiful. So what timing do you generally say for that first GP visit?
It's actually different for every woman because some of them get symptoms of pregnancy, some of them just miss their periods. So we'd say as soon as you think that something's going on, just go and see the doctor. So that can be as early as 4 to 6 weeks. You don't have to wait till longer to go and see them. So the earlier the better.
So get in early?
Yeah, absolutely.
Beautiful.
And that also helps you to be able to get in to see the right specialist that you want to choose as well, because doctors like Dr Bronwyn Hamilton book out really early. So if you don't get an appointment with her, then you'll miss out on getting her for your pregnancy care. So I'd say the earlier the better you go see your GP, then we can facilitate what happens next.
Yeah, beautiful. And so what kind of things do you do at that first GP appointment?
So it's a couple of different things. A lot of it is obviously congratulating you and your family for the exciting times ahead. It can be very nerve-wracking. So I think we'd like to just do some general health checkups, check your blood pressure, your weight and your height, talk about any risk factors that might be there for this pregnancy as well. Just make sure we optimise all of those. And then talk about some vaccinations, and then we'd like to organise some blood tests as well, so that we can check things like your blood counts and some infection tests as well, and then check some urine for infections as well. And then we like to get in and book in an ultrasound for you so that you can find out where the baby's growing and also how big this baby is as well. Absolutely.
Beautiful. Awesome. So that's really helpful, I think. Yeah, beautiful. And so what do you kind of do in terms of organising that next kind of step in terms of women being cared for the rest of their pregnancy and birth? What do you kind of do there?
Yeah, women in Australia are really lucky. They get a lot of different choices for pregnancy care. So we can organise for the referral to be done to a specialist obstetrician who will look after your pregnancy visits and also look after the delivery of the baby as well. And also the aftercare after birth as well. So that's one option. And then women have the option of going in the public health system as well, where they'll get seen by a combination of doctors and midwives. And that they'll take care of the in pregnancy sort of checkups and obviously the delivery as well. And then you've got another option where you can see someone like myself as a GP obstetrician. You can take care of part of your pregnancy. The hospitals can take care of part of your pregnancy and deliver your baby. And then we can look after the afterbirth checkups as well. So there's a lot of options. It's actually hard to decide.
So many options.
Yeah, it's hard to decide. So we usually give you a lot of the options, especially around where you live, because that does make a difference to what's available. Because you don't want to be travelling 2 hours to get to the closest pregnancy hospital.
No, don't want to have a baby in the car.
So we'll talk to you about what's available and what you're sort of wanting out of your birth experience, and we'll try and find the best fit for you.
Beautiful, awesome. And some people kind of think once they, are referred off to the public hospital or their private obstetrician that they can't see their GP anymore, but it's not that way, is it?
No. I've got many different patients that see different specialists or the hospitals, and they still talk to me about certain things. Sometimes at the hospitals they'll say something and just want some clarification. Sometimes the partner wasn't able to make a consultation, so we might redo one of those consultations with the family so that they also feel involved with the pregnancy care, which is really important.
Beautiful.
And then we basically can look after other things, because there's other things that happen during pregnancy too. You might fall sick, or you might get a bladder infection, or your kids at home might be sick too. So we have to look after everyone together. So don't feel shy to book in appointments with your GP, and make sure you see your specialist if there's any concerns as well. So we're all there for you.
Yeah, that's right. And you can have your vaccinations.
Absolutely, So I often see pregnant women quite a few times, and in my GP practice we make sure that pregnant women have priority to make appointments, even if we're busy. So don't feel that you can't go see a GP anytime if you need.
Yeah, that's right. It's awesome to know. Beautiful. And also, what kind of reasons would you say, what kind of symptoms would you say that women in their early pregnancy should definitely kind of seek medical advice for? What kind of symptoms would you be worried about?
Yeah, it's quite an anxious time when something you feel is going wrong with the pregnancy. Mums tend to have a bit of an instinct, but sometimes you actually don't know if it's your first pregnancy.
That's right.
Yeah, so generally if you get any sort of pelvic or lower tummy pains, you'd make sure you get checked up with the GP. If you're having any bleeding or spotting, sometimes all these things are normal during early pregnancy, but sometimes there can be things that we can help out with and make sure we check up further. So if any of these things are really severe, we definitely get you to go see the hospital. Like don't wait till the next day or a few days and suffer at home. We all want you to get the best care during your pregnancy, and there's so many things available. So you can always go to any public hospital that's nearby your house, and they'll take care of you. They have lots of pregnancy doctors available. They have the emergency doctors available, and they've also got access to talk to doctors like Bronwyn if they need extra help with. So
like heavy bleeding, severe pain.
And nausea. Nausea is a good one as well, because that one affects a lot of women. Like there's different severities of that. So some people will get some nausea and they still can't eat much food. Others will be vomiting after every meal. So some of them will need some. Don't suffer. We can definitely help out, and some of those things we can do with medications from the GP. Sometimes you'll need to go into the hospital to get some fluids just to help you be energetic and be able to cope each day. So
fantastic. That's good. Great advice. Awesome. Yeah. So I think that's been an amazing educational chat. I just wanted to, finish in saying that, early pregnancy in particular is a really, time for high anxiety.
Absolutely.
Especially when it's your first pregnancy, it's just so nerve-wracking, and you're like, what's this? You got this heightened anxiety, and it's all new. You got the crazy hormones doing crazy things, and your body's changing and all those kinds of things. So, it's a really, time that you will feel vulnerable and anxious, and there's no silly questions. We love those silly questions. We love you to call us anytime, whether you call your GP or whether you call your obstetrician or you call your maternity hospital. If there's any concerns or questions that you have, make sure you seek medical help from your care providers. And don't suffer at home, stressing or doctor Googling. That's definitely not the way to go.
Yeah,
definitely, there's lots of help available for those early pregnancy issues, and so that you can hopefully feel a little bit less stressed in that first trimester.
Yeah, it's very important.
Yeah, beautiful. Yep. Well, thank you so much for joining us today. Thanks, been Bronwyn. Awesome and very educational, I'm sure, for all the viewers.
Yep. Thank you.
Yeah, so it's been awesome. So, if you, thanks for joining us. And if you like what you see, feel free to like and subscribe and hit the bell for further notifications. And we hope to see you guys all again soon. See ya.
Bye.